Hi, I'm Dr. Ruchi Garg, Senior Consultant in Obs and Gynae at Cloudnine Hospital, Gomti, Nagar in Lucknow. Today, we will understand the myths and facts about menopause. What is menopause? When does it start? And what are the myths associated with it? Does menopause mean only the end or stopping of menses? The answer is no. It is associated with many other changes and symptoms in the body of the female. Does it start in a particular month when the period stops? The answer is no. It is a slow and gradual process that spans over few months and sometimes over 3 to 4 years. And this period is called the perimenopausal period in the female's life. What are the changes that a female experiences during the perimenopause? Not only does the frequency and the flow during the menses change in these months, but also there are many other body changes. For example, there are mood swings, lethargy, and low energy levels that are experienced by the woman during this period. Next, the change in body weight as well as body shape is seen. There are changes in the skin and hair texture. Besides this, the patient will also, or the female will also experience that there are changes in a sleep pattern. Besides this, one very important symptom that is experienced by most of the females going through perimenopause is hot flushes. This means that in spite of what the weather is or the temperature of the room is, the female will experience a sudden increase in body temperature and can also be associated with sweating. Sometimes symptoms are so severe, one has to resort to certain medications in order to overcome them. What is menopause? By definition, if a woman has not had menses for an entire 1 year, then she can be called as a menopausal female. Now, what if you are having a pervaginal bleeding or menses after that 1 year period? Then this is called postmenopausal bleeding, and this is not normal. In this situation, you have to consult your gynecologist and you would be advised for something which we call as the endometrial biopsy. One should undergo the endometrial biopsy if you are experiencing postmenopausal bleeding. Another myth about menopause is, can you get pregnant after menopause? The answer is no. One can get pregnant after menopause only if one is on the hormone replacement therapy, because these hormones can trigger the ovulation in the female's body and result in pregnancy. Also, if you are in the perimenopausal period, which means that the menopause has not set in, but the body is preparing for the menopause to set in, during this time, since the periods are very irregular sometimes, that is, one may not have a period for a good 3, 4, 5 or 6 months, again, this patient or this female can have pregnancy during this time. The third myth, do all women who are having menopause require hormone replacement therapy? The answer is no. There is only a certain segment of patients who have very severe menopausal symptoms like severe hot flushes, genito-urinary symptoms, severe osteoporosis. Only in those patients we recommend the hormone replacement therapy, and that too after ruling out certain conditions like liver disease, cardiac disease, and certain cancers in which this hormone replacement therapy is contraindicated. Only in those patients is it recommended. So, menopause is such a phase in a woman's life which one has to be prepared for by knowing the real facts and overcoming the myths. Consult your gynecologist if you are experiencing severe symptoms or if you seek for further counseling. Take care.